Dr. John Lucio. I practice integrative medicine pain management in Jefferson City, Missouri, and this is my wife.
Hi, I'm Dr. Jennifer Sue, and I do private practice OBGYN. And our channel, if you've never joined us before, is integrative medicine approaches to treating different types of medical topics. We upload one video a week. I think we missed 2 weeks ago because I had pneumonia, and so we missed that 1 week.
A lot of people in our community already know this, but about a year ago I was diagnosed with prostate cancer, and I went through the treatment, and so I had to become very well educated in terms of how to understand the disease and what things I could do actively to help myself.
Dr. Andrew Weil is the founder of our program. He actually wants integrative medicine to just change into total integrative medicine and not even call it integrative anymore.
Right.
One of our lecturers, Dr. Donald Abrams, who works in San Francisco, California at an integrative cancer, it's the Osler Institute for Cancer. He's an oncologist, integrative oncologist, and his point for treating patients there is that they do not treat the cancer, they treat the person with the cancer. And I think that's a huge, big difference in the treatment and outcomes of these patients. Number 1, what increases our risk of prostate cancer? Number 2, things that you can change to avoid getting prostate cancer. Number 3, different ways that help diagnose prostate cancer. Number 4, things that we can do ourselves to help treat the prostate cancer. And number 5, the last one, will be steps that we can take ourselves to help prevent getting prostate cancer again. And I think you do a lot of them as well. So I'll do the first 2, and then my husband, Dr. Lucio, will cover the last 3. What are things that increase your risk of getting prostate cancer? Well, you want to look at your family history. If you have any family members that have had prostate cancer before, you're at increased risk. Number 2, if you're of African ancestry, you're at increased risk. And number 3, if your age is above 50, you are at increased risk for it. Actually, 95% of all prostate cancers are diagnosed in men men over 50. So 95% of prostate cancers are diagnosed in men over 50. There are other things that can increase your risk that you can probably try to help yourselves with, and these are called modifiable risk factors. And of course, the number one thing is trying to decrease obesity, because obesity does put us at increased risk for getting prostate cancer, which leads into if you can get some exercise into your routine. They don't find that exercise prevents prostate cancer directly, but they think the way that it does help prevent prostate cancer is that it decreases your risk for obesity. And so he's going to cover this later in the prevention of recurrence of prostate cancer, but you want to try to get at least a total of 150 minutes of exercise per week, or 30 minutes per day, 5 days a week, in any combination. You can do 5 minutes of walking to the store here, parking further away, taking the stairs. Anything that adds up to that per day works. It doesn't have to be continuous 30 minutes a day. And another modifiable risk factor that you can try to help yourself with is if you find that you have a very stressful life, incorporating some kind of techniques to handle that stress. I enjoy the square breathing technique. Square breath is easy and it's quick. I can grab it any time. And pretty much could I do it right here in front of them? What we're going to do is if you find that stress... if you find that your job is getting stressful or things in family life is stressful, no one knows you're doing it, but you breathe in the nose, hold it, and then breathe out the mouth. Hold it. Breathe in, hold it, breathe out, hold it. I do that whenever I'm at work and I find that there's a lot of phone calls coming in, or I know patients are building up in the waiting room and I have a patient that needs more time with me. I will do that and the patients don't even know, and I can truly feel my cortisol levels and stress decreasing. I kind of moved into number 2, which is things that we can do to help prevent prostate cancer. Limit your red meat intake, limit alcohol intake, and you want to eat more vegetables, especially cruciferous vegetables, and the foods with lycopene, which give it that rosy color. So watermelon, strawberries, and tomatoes. And on a side note, if you're going to eat tomatoes, try to cook them because that helps the lycopene work. Lycopene is what gives these foods like watermelon, strawberries, and tomatoes that rosy color. And that lycopene is a very good cancer-fighting antioxidant. So you do need to cook those tomatoes to make it more beneficial for cancer fighting. You want to decrease your intake of energy-dense foods, which are sugary foods, sugary sodas. Most likely, doing this helps prevent prostate cancer only because it decreases your risk of obesity. You want to eat more vegetables, legumes, whole grains, and fruits. Soy protein's actually really good, and you can actually replace your cow's milk with soy milk. Flaxseed is wonderful as well as green tea and pomegranate.
Touch on a subject of what is called the prostate-specific antigen, and there's a lot of controversy behind that. In fact, some organizations recommend against routine testing. I can tell you from a personal standpoint, I recommend it. It's a very few time where we're going to say something like this. The diagnosis actually begins with symptoms, and they're very similar to you get when you have an enlarged prostate, such as difficulty urination, frequent urination, nighttime urination. And then if you go to your physician with those recommendations and you're over 50 like I was, they did do a prostate-specific antigen and it was elevated. Well, we just didn't follow that one or use that one value. We started following the PSA over a period of time and watched to see if it would go up and try to treat any other symptoms or any other conditions that cause an elevated PSA, such as urinary tract infection and prostatitis, and benign prostatic hypertrophy was just as a big prostate. So it got to a point though after a period of over 8 years where my PSA started to get elevated, and we did do a prostate biopsy, which was negative, and again we followed the PSA and it continued to rise. At that point I did undergo what is called a prostate MRI, which is a specific technique in which they use the MRI technology to pick up the small lesion of the prostate and pick up any lesions that are within it and use that mapping to guide the urologist to make the biopsy, and that's how they picked up my cancer. So if it hadn't been for the PSA, I think I probably would have continued just following it because I had very little in the way of symptoms. I was pretty healthy. So in my opinion, I think it's, and my opinion is supported by the American Cancer Society and
the American Urological Association.
Exactly. So at that point,
it's the U.S. Preventative Task Force that recommended no screening with PSA.
No routine screening.
No
right?
routine screening of PSA, only because their point was to avoid
unnecessary testing and treatment. Correct. So basically, that's how your physician will make the diagnosis of prostate cancer. So the American Cancer Society recommends that you have routine screening after the age of 50, and after the age of 45 if you have increased risk factors, and after the age of 40 years old if you have first degree relatives that had prostate cancer before 65 years old. Now, what things you can do to help treat your prostate cancer? So let's say in my case, I was diagnosed, and because of the grade of the cancer, it was recommended I undergo surgery, which I did. But there are still some other things I can do actively that do not involve just sitting there recovering from surgery. That'll help me in terms of treatment of my prostate cancer to help or prevent recurrence. And those are very similar to what Dr. Sue just mentioned here, included lifestyle changes such as stop smoking, alcohol in moderation, dietary changes such as limiting red meat, increasing intake of vegetables and fruits, and some of the ones Dr. Sue mentioned are extremely important. Soy is an amazing isoflavone, which you do not find in our diet very much. And if you look at the Japanese culture, men have a much lower rate of prostate cancer, and their level of isoflavones, which is contained in soy, are much higher than ours. However, when that same population of people come to our country, they start adopting the same increased risk of prostate cancer. So there are a lot of things in our diet that actually predispose to prostate cancer.
So it's not the race that helps protect them against prostate cancer. It's
Right.
truly diet, the soy.
Exactly. In that case, exercise is extremely important. Dr. Sue mentioned using 150 minutes a week. It can be a vigorous exercise. It can be almost anything. Obesity is an interesting risk factor for prostate cancer because obesity results in increased risk of insulin growth factor, which as it increases also predisposes to prostate cancer. So it's an important factor which we can modify. One of the things that surprised me in my treatment was that after I had my cancer removed, my chances of getting the cancer again were not zero. I would have expected it to be zero, but they were not. So I still have to do a surveillance and check my PSA on a regular basis. I still have to follow those dietary recommendations and lifestyle as well. So again, I'm actively involved in my home treatment plan, and it actually empowers patients as well to let them know that there's something actively that they can do to help themselves.
It actually helps me too because I'm eating healthier as well and being more active.
Okay, everyone, thank you for joining us. Next week we're going to be doing
Women's health. I can't
Finally.
wait. No, but men's health was interesting. For next week's women's health topic, we'd like to cover libido, which is sex drive. That's probably one of the most common topics that I hear in the office, and women just want to kind of know what they can do about their libido when they have decreasing sex drive. So thank you again for joining us. We have a great weekend.